Welcome back to the Oral Health Podcast. Now, I know that I personally quite like a bit of relaxation. It's Relaxation Day today, so we're going to talk a little bit about relaxation and sedation when you go in to visit the dentist. This is something that obviously you discuss with your dental team well in advance so they can best advise you, but we're just going to go over basics, including different types of sedation, different relaxation techniques, and we might even dabble in a little bit of hypnotherapy. Um, Karen, are you feeling
Yes.
relaxed today?
Yes, as relaxed as you can in the middle of a working day. Yes, I
Yeah.
do feel relaxed. I I must admit I do find it relatively easy to relax. I think it's something that I think you can either do or you don't, and I suppose it depends what kind of situation you're in. A lot of people don't find going to the dentist very relaxing at all, and we totally understand that people, it can vary from sort of minor trepidation going to the dentist or abject terror, full on phobia that you can't even get the patient through the front door of the practice. So I think everybody would benefit from perhaps looking into how they can make a visit to anything that makes them feel stressed a little bit easier, but especially going to the dentist, because we do totally understand that it's not everybody's favourite place.
Absolutely. Now, let's talk a little bit about just minor fear, although I'm sure it doesn't feel like minor fear to someone that's got it. And then we'll move into more, you're going to require some help to get to the point where you're having your treatment. So, um, let's then just open up with hypnotherapy. I know there's a few different people that swear by it for things like, quitting smoking, losing weight, things like that. Never heard about it using to go to a dentist.
Yeah, I mean, there are techniques to manage anxiety in hypnotherapy that people can have with them all the time. So they might have had it for any kind of anxious, stressful situation. And those techniques can be passed over into preparing yourself for a dental visit. So if you go to a hypnotherapist, they will be able to give you, I mean, you don't need to bring them with you to the practice. They will teach you coping mechanisms so that you can just bring that stress level down. So we're not, when we're stressed or afraid, our bodies release chemicals that actually make the anxiety worse. So it's sort of like a vicious circle. So what we want to do is try and calm the body and reduce this response. So hypnotherapy is one of the ways that we can do that. Also doing something repetitive, something really simple as when you're sitting in the dental chair, um, the touching slowly of each finger on the thumb can
Hmm.
often help. It can often help by concentrating on, pressing down your big toe, then the next toe, then the next toe. So you're concentrating on something else. So your mind's almost occupied concentrating on that. And then that gives you that sort of overall stress relieving, really. But there's it could be that you need to go to your doctor and get a sort of a mild sedative
Yeah.
to do that. Obviously, that's something you would need to discuss with your dentist or your doctor. You wouldn't be able to sort of go to the practice on your own or leave the practice on your own, and certainly not drive. So that would be something, if like the next step up. But the it's certainly worth looking on the internet as well, because they will, there's lots of different relaxation techniques that you might find work for you, and you might find it works in other situations as well. I mean, I find it horrible, and you probably think this is really weird, but I find it really, really horrible to speak in front of people, a big room of people. And I know on a podcast I'm only speaking to you, Sophie. There's nobody else there, so that's absolutely fine. But yeah, there's kind of like everyday situations that we find ourselves in, that this kind of hypnotherapy techniques will work for too.
Hmm. I will say as well, while I'm not a mental health professional, I've been through various like qualifications for like mental health first aid, and a lot of that is focused on that relaxing in the moment. I recommend if people are interested in it, they do a little bit of digging on their own, but it is a lot of the things you've said, things like box breathing. Have you heard of that? Or finger
I
breathing?
haven't.
Okay, I can teach you something.
Go then.
Right,
Come on.
everyone listening, do this with me. You hold out a finger in front of you, and then you breathe in when you draw it up, and hold it while you draw it across, and then breathe out on the bottom, and then hold it as you go along, and then you keep breathing and holding, and you make a box. And it helps
Okay.
regulate your breathing, or you can look at your fingers and spread your fingers out and breathe in as you draw up the finger, and then down, and then up, and then down, and you so it just is doing something tactile to help focus on your
Uh,
breathing techniques. And
that's
it's
that just
yeah.
yeah, I mean, that reminds me of something my mum used to do as well, sort of a yoga technique where you hold the nostrils, breathe in one side, hold, and let it out the other nostril.
Hmm.
Um, that was something she used to do. That's slightly different with dentistry because you can't really get your hand up to your nose because there's
Yeah.
lots of other things going on. But it's the same sort of thing. I remember speaking to somebody on when on our dental helpline who was very nervous about going to the dentist, and I just gave her a few things about, like I said, touching each tip of the finger and just concentrating. And she actually phoned back, and we didn't really used to get a lot of sort of feedback and say, oh, this worked or this didn't work. And she actually phoned back to say, thank you. I've managed to have a filling done and an extraction just by kind of making my mind think about something else. And she
Hmm.
said, I'd kind of blown everything out of proportion. And I think that's kind of what we do.
Yeah.
We instead of um, looking at dental treatment as a process. So we have like the first barrier is walking through the front door. The second one is speaking to the receptionist. The third, people think of it as a mountain that they've got to climb to get to the other side. But just break it down into little pieces and congratulate yourself on the small wins.
Yeah.
And the more confidence you get, I mean, just walk into the dental practice, just get used to the feel of it. Ask them for, the practice brochure. You've spoken to the receptionist, you'll recognize that face the next time you go in. So all of these things are sort of calming familiarization. And I think the more familiar we get with things, the less it's going to worry us. And let's face it, dentistry these days, if somebody hasn't been to the dentist for a long time, they will probably find it a completely different experience. And dentists, modern dentists, are very, very aware of
Hmm.
patients who are anxious, who are phobic, and they know how to work with them. And
Yeah.
it's just very slowly you take it at the patient's pace, a symbol, a sign to say, stop, let's have a break. And it makes it very, very easy. And I would always say, when you phone to make an appointment, say you are a nervous patient and ask to see the dentist who's got the most experience with nervous patients, and they will be much more aware of your situation. But
Yeah.
there's no shame in saying, this is my this is my fear. I don't like this. I don't like that. Some people might not like the injection. Some people might not like having lots of things in their mouths. Some people might have a gagging reflex. It's not the first time that a dentist will have experienced your type of fear.
Yeah.
And I think that's what you have to remember. You are not the only person that they've seen, probably even that day, that is experiencing these fears. It's
Hmm.
normal.
It really
This
is. A
isn't an
dentist is one of the
everyday
most
thing.
common fears, going to the
Oh,
dentist.
totally.
And so
Totally.
it's understandable. It is quite invasive. You've got a stranger's hands all up in your mouth, and it's uncomfortable, and it's fine. It's like the Snickers advert. You're not you when you're hungry. You're not you when you're scared either. You know, you
No,
like,
not,
and people
not.
are understanding of that, especially dentists, because they are used to having people be a little bit fearful.
I also think when people haven't been to the dentist for a long time, they build the experience over and over in their head until it gets worse and worse and worse, and
Hmm.
to the point where they can't go because they had such terrible experience the last time. But I think when you start off slowly, maybe the dentist just polishes your teeth. Maybe you just get used to speaking to that dentist. Maybe you go to the hygienist first, and there are ways that a dental practice will work with you. And we don't have to just stop at relaxation and hypnotherapy. There are more ways of making dental treatment uh, more acceptable and more able
More
to be
comfortable.
carried out with, yeah, with sedation.
Yeah.
And it depends on the form of sedation. Um, there are a couple of types of sedation. There is the gas and air sedation, which is inhalation sedation, as we call it, which so you're
That
breathing
sounds
in a
really
mixture.
inhalation sedation. That's got a nice little ring to it.
It's just it's nitrous oxide and oxygen. So basically, it's what you'd have if you were in labour. You know, when they, I mean, obviously men may not like tune into that bit, but it's basically what you're breathing in if you've ever had gas and air for any other procedure. They do gas and air for lots of minor procedures in hospitals now as well. And obviously you can't breathe it through your mouth like you would if you were in labour. This is a little thing that sits on your nose, so you're
Oh.
breathing in it through your nose, so the dentist can carry on working with you, working in your mouth.
Is it
So
a
it's
bit
sort of a
like a CPAP that goes on your nose?
uh, yeah, it's not as big as that. It just sort of fits over. This is very visual, but it sort of fits over the end of your nose, really. So it's just sealing your nostril. So
Hmm.
when you're breathing in, you're getting the nitrous oxide. Um, Now that may be enough for most people. Obviously, you'd still have the local anaesthetic, so that will numb the area. Dentists can put a topical anaesthetic on before they put the injection, so you don't actually feel the injection. There are certain types of injection that are uh, the anaesthetic, the local anaesthetic is put in very, very slowly by a computer. So whilst it's still an injection, it happens so slowly that you don't actually feel it as a needle. Some dentists have that system. Um, so that hopefully will take away the the anxiety. With I mean, gas and air makes you feel quite floaty. In fact, we used to call it floaty air when we used to give it to children for extractions. Um, and it's normally enough to make you feel like, oh, that's okay. And it makes time go quicker as well, actually. But if you need a little bit more, if you need to be sedated a little bit more, there's intravenous sedation. So that is a small injection in your hand or in your arm, and it's then administered in that way. It's kind of that makes you feel more relaxed and drowsy. You're not asleep, so if the dentist speaks to you, you can answer them, but you're feeling quite sort of, it's like you're lying on a sunny beach somewhere, and there's an annoying person that keeps speaking to you, but you won't be asleep, so you'll
Hmm.
be breathing for yourself. So it's not like a general anesthetic, it's just being sedated. So as I say, again, it has a slight amnesia effect, so you don't really remember the treatment. But it does take time for the effects to fully wear off. So you will need someone to be with you, take you home, um, and you mustn't drive, drink alcohol, or operate machinery for the rest of the day. The next day you should be fine. So you'd be fine to go back to your job or whatever it is you do. But those are things that are available. Not always available with every dentist, but certainly you can get referred for sedation. So if you feel that you are not going to be able to tolerate the treatment in the dental chair, you can ask your dentist to refer you. Under the NHS, there does tend to be a waiting list for this, so it does tend to be a little while because it's quite a oversubscribed service, but you are certainly entitled to that referral. Some dentists provide the sedation bit privately, so it's worth asking them how much that would be, which obviously would speed up the process.
Hmm.
But yeah, I've
And
had a go at both, so
okay.
I can for either of them. No, I mean, not. I've had inhalation sedation when I had teeth out before orthodontic treatment, and I've had other sedation for other minor surgeries. So yeah, I mean, they're do what they say on the tin. I mean, they work. You feel
Hmm.
sedated. It allows the treatment to go ahead, and you are not distressed, and you're not in pain, and it wears off. So everyone's a winner, really.
Yeah. It's tried and tested, you know, they wouldn't offer it if it wasn't safe. So that's the way
No,
I've looked at
exactly.
it. Yeah.
Yeah, I mean, it's far safer than a general anaesthetic. So, you know, we always try and keep away from a general anaesthetic at all possible because there are much more risks. It's obviously a hospital visit. You could be day surgery, but they would only do general anaesthetic for very, very extreme cases, probably um, difficult extractions, etc. So, um, but for most people, they find sedation um, is enough for them to have the treatment.
Yeah. That's good.
But
And I
there's
hope
nothing
that's
better
mm,
seeing a phobic patient come in. There's nothing better than seeing a phobic patient that has come in sort of 6 months, a year before and has been really nervous, coming in for their checkup and needing nothing done and feeling like they can get in the chair and feel, I don't say they're going to skip through the surgery door or anything like that, but they can do it. And they know that nothing in there is unsurpassable. And, you know, it's a great moment for them because it's very proud to get over a phobia is an amazing achievement.
it is. It's a massive achievement. And I hope that's
Mm.
given some comfort to people. Yeah, I know a few people that find dentist visits quite tough and they definitely follow that kind of guidelines and like I'm sure that is going to be really comforting and yeah,
Hope so. Hope
hope
so.
people
There's
find
nothing
the best.
worse than feeling like that and being in pain potentially with toothache and thinking that you can't that nobody's going to be able to help you because there is help out there.
Definitely. And yeah, don't be afraid to talk to your dentist about this stuff. They are used to people being scared, as unfortunate as that is, it's just a fact. But yeah, keep well. Come back and listen next time we have a chat about something that'll be
Well,
completely different to this. And yeah,
have a lovely relaxing day.
yes.